Thanks for joining us on Sound Ideas on WGLT. A new program at ISU's Mennonite College of Nursing will simulate the ins and outs of telehealth care in rural settings. It's a byproduct of ongoing collaboration between ISU and OSF Healthcare. In this latest edition of Sound Health, WGLT's Lindsay Jones speaks with Mennonite College of Nursing Associate Dean and Assistant Professor Susie Watkins about why nursing education needs this kind of teaching.
And one of our goals in nursing education is to teach students how to practice in relevant healthcare systems. And currently, we lack education in telehealth technologies. It's actually one of our accreditation standards moving forward to teach students how to use technology and innovative resources to deliver care, not only in acute care settings like hospitals, but in community-based settings like rural health clinics or medically underserved areas where patients really lack access to health care. So we at Mennonite College of Nursing, Illinois State University, we really want to teach our students and introduce them to technology, specifically telehealth technology, so they will be more comfortable when they graduate and they will be more ready to address needs in rural areas using telehealth technologies. This project is really going to help us introduce our students to this type of technology and have them do hands-on practice with standardized participants that make it more real life.
And that's a perfect segue. So when you say this project, what do you mean by that?
So this project is titled STARTED. It stands for Simulation to Address Rural Telehealth Education Development, which is what we are intending to do with our students, is really teach them about telehealth technologies and how these technologies can be delivered and used in remote areas to connect clients needing healthcare with providers who can receive assessment data and make diagnostic decisions and further treatment decisions on what the patient needs without physically being there, placing their hands on the patient, doing assessment, because the technologies would allow that to be done and sent through the technology platform.
I'm trying to picture that in my head, how that works. I live, somewhere out where this telehealth platform is being offered. What does that look like for me as a potential patient when I try to engage with that platform?
One example I think of is currently we have on-call systems and where we can do more, as nurses, we can do more telephone-based care. An example where that wouldn't work per se is when a patient would, maybe a mom has a young child that has ear pain and has been up all night, and it's going to be a long drive to a prompt care or a hospital or their primary care clinician to look in the ears, and they're really concerned. This technology would allow a clinician to be at a distant site and perform an ear exam and send that ear exam to the provider at a distant site that might be working in a larger clinic at a different site than the client needing the care. So with this technology, we can do what's called a synchronous visit, where you're live with the provider, and as you assess them, they are seeing the inside of the ear. The technology has camera where they can see if the eardrum is perforated, has a hole in it, or is draining, or is bulging because there's infection in the middle ear. So they could make more of a treatment decision, whereas on the telephone, that limits the provider's ability to see that truly is an ear infection and that they may need antibiotics for that.
I guess I couldn't tell if this was something that was still in development and how far along in development it was, or if it was something ready to go for these incoming nursing students.
We are actually in development, and we plan to implement our first simulation in February. We'll have 2 rounds of simulation. We'll have some scenarios geared for our family nurse practitioner students that are in the graduate program to become certified nurse practitioners. And those will happen in February and March. And then we will take our undergraduate baccalaureate in science and nursing students. We'll hopefully have 120 of those go through the simulations starting in April. Feeling very excited. It feels like we still have a lot of work to do, but I feel like we just have a short time span to get that developed, but we're well on our way.
That's Mennonite College of Nursing Associate Dean and Assistant Professor Susie Watkins speaking with WGLT's Lindsay Jones.
Support for WGLT health coverage comes from Carle Health. You can count on Carle as your partner in healthcare. Information at carle.org.